So hello everyone, my name is Peter Nash. I'm a professor of rheumatology at Griffith University in beautiful downtown Brisbane, and today we're talking about one of the abstracts presented at ACR Philadelphia, ACR Convergence. This is a European study. It was done in Poland and Czechoslovakia and Switzerland. It's called the Go Back study, and it's looking at AxSpA and terminating or tapering therapy. So it's a phase 4 study, but it's looking in particular at nonradiographic AxSpA and asking the question that if you withdraw a TNF, in this instance it's golimumab, can patients, how many will flare and can you recapture them if they do? So they took patients who had active non-radiographic axial SpA, and these patients had disease of less than 5 years duration. They were under 45 years of age, and they gave them open label golimumab monthly for 10 months. That was the first period of the study, and they found that the significant number had inactive disease after 10 months. In fact, of the 323 that started, 188 were inactive after 10 months of treatment. So then they asked the question in the second period, those patients who were inactive, if we either continued full treatment monthly, tapered them to every 2 months, or gave them placebo, what would happen to their disease? And of those that flared, can you recapture them? So that was the primary endpoint, the percentage who didn't flare once you tapered their therapy, and compared that to continuing full monthly dosing. So what happened? The monthly dosing, 84% of patients did not flare, versus second monthly dosing, 68% of patients didn't flare, and if you change them to placebo, 34% of patients didn't flare over the subsequent period of a couple of months follow-up. Now, of the ones who did flare, you could recapture 96% of them over a couple of months. So no real harm done getting back to where you were and recapturing them. So again, this is another study that confirms tapering can be successful, but cessation is asking for a flare, and it speaks to whether your glass is half full or glass is half empty. You can stretch it to second monthly, and 68% of patients will stay in good shape. But if you want to maintain them, 84% if you continue monthly and you don't taper. So they're your choices. Don't stop, taper if you want to by increasing the treatment duration rather than stopping medication altogether, and that's the take-home message. Thanks very much.